All right, we're about to kick things off with the case competition. I'm Mark McKee. I'm the VP of the case competition for the healthcare club here. I'm a second-year MBA. Today, we will have the privilege of hearing from our top three teams. However, the twist is that these top three teams do not know yet what position they fall. They just know they are in the top three. So you'll get to hear from them. The competition was actually last weekend, in which they presented and received their rankings. All of this will be recorded and put on our YouTube channel for CBOH. Welcome to Team 5, right? All right, thank you all.
All right, good afternoon, everyone. We are very excited to share with you all our strategic proposal for South Coast Behavioral Hospital. My name is Kira Griffith, and I'm joined by my colleagues Josue, Bradley, and Tosan today. And our recommendation is that South Coast Behavioral Hospital adopt a comprehensive employment recruitment package for experienced behavioral health nurses. And we're calling our package NurseWell. NurseWell is comprised of four major components. 1, comprehensive benefits. 2, relocation assistance. 3, professional development opportunities. And fourthly, what makes our program unique, a community ambassador program. So when thinking about the key question for this case, we believe that option 3, hiring experienced behavioral health nurses, would be the best option to meet all of the organizational needs. We believe in the short term that hiring these nurses will address the clinical staffing shortage that exists. And in the long term, this will help with improving the work culture and increasing retention rates. While there are costs associated with adopting this plan, we believe these costs fall within the budgetary constraints. And we also believe there's actually significant savings to be had with this proposal. So I'll now pass it on to Tosan to talk more about our healthcare landscape.
Well, thank you, Kira. A very simple Google search will reveal to us from high-impact journals as well as reputable sources, including the American Psychological Association, that the U.S. adolescent and behavioral health system is struggling. And this has only gotten worse post-COVID. We know for a fact that since the pandemic, the percentage of U.S. teens reporting major depressive disorders, ranging from psychosomatic illnesses to schizoaffective disorders, have always just gotten worse in the northwards of the 100% across gender lines. We also know that within 2019 to 2022, at least 75% of high school students have reported having at least one adverse childhood experience, and this does not even factor in COVID. Things around social isolation and academic disruptions have only worsened this exacerbation and has made healthcare access even a lot more difficult. Now, all of this comes at a cost, and the cost implication we've seen from recent surveys that in excess of over $185 billion will be spent on lifetime costs in trying to figure out how best to manage the behavioral health crisis. The pediatric behavioral health system is also increasing spending by over 30%, which has been projected to have an annual accrue in 5 years to $30 billion. So there's a lot of spending happening within the space. And so in states like Massachusetts, which is where South Coast is primarily domiciled, we're finding that the government is also seeking for parity in reimbursement between behavioral health and other forms of health. However, we look at the whole landscape, and one of the things that sort of stands out there is this crisis that is happening there. So we are seeing that there is a workforce crisis, which has been spoken about extensively during this conference, owing mostly to three things. The first being the retirement of the generation of the baby boomers. And we're also seeing that there is a decrease in the shortage and supply of healthcare professionals into the system each year. And we're also seeing the massive exodus of professionals going out of the system owing to burnout and related issues. Now, this workforce crisis is having a patient backup crisis where at any given time within the care continuum, over 1,000 patients are unable to advance into the next level of care simply because, well, there are no staff to sort of meet those needs. And that is also having an impact in the behavioral space, where over 500 patients are burdened here beds as well as, well, acute med-surg units simply because of the unavailability of specialized behavioral health beds. Now, we're also seeing that there's an impact on the patient demand crisis, where hospitals in response to this crisis are having to take beds offline. And that also has an impact on supply chain. Case in point, Hurricane Helene, that's shown us within North Carolina with the affection of the North Cove Baxter, where over 85% of medical consumables around isotonic solutions and intravenous fluids were disrupted across the Midwest and across the Northeast. And all of this is also pointing to the fact that we are losing $400 million on uncompensated and unreimbursed care. Now, looking at the state of Massachusetts, between 2019 and 2022, you will find that the vacancy rates for psychiatric nurses have actually doubled from about 10% as of 2019, and it's now going northwards of 20%. Now, this it's not unique to psychiatric or behavioral health nurses, but you also find that across the care continuums of hero nurses, nurses that operate in other forms of specialized nursing services. Now, the impact of this, in a recent survey done in 2022 of August, across 3,000 behavioral health facilities in the state of Massachusetts, there is a reported percentage of over 20% of facilities needing to take these beds offline simply because they cannot meet with the consumption or the demand. Now, when we look at South Coast itself, there are also a myriad of problems happening here. First is the geographical isolation. South Coast is currently located in Dartmouth, which is about 90 minutes from Boston and 45 minutes from Providence. That makes it very uniquely less appealing to attract experience or attract new staff to come work there. There are also issues around the high nursing turnover rate, currently at 60%, that also has a direct impact on the operational capacities, where the facility is currently operating about 3 to 5% underutilization within their current resource constraint. We're also finding things like regional competition for magnet hospitals. We're finding things where there is a narrow candidate pool because the hospital has a major focus on child and adolescent health. We're also having issues around state licensure. Massachusetts is the state that has no compact, and that means that nurses out of the state cannot practice within the state, and that also severely limits travel nursing options. And then overall employee dissatisfaction, as well as the operational utilization. Now, all of this, ladies and gentlemen, presents a truly unique problem, but with that comes a leverage for us to find a good latitude to be able to propose a solution. I'm going to pass on to Brad, who's going to take us into the steps of the nursing program, which we've called NurseWell. Brad?
Sure. Thank you, Tazan. So really, what we're focused on here is improving our clinical staffing shortages and our operational efficiency at South Coast Behavioral Health. And so how do we do that? So our team is proposing a 4-tiered comprehensive benefits package titled NurseWell, which is really catered at both recruiting and retaining our experienced nurses. Those are our LPNs and our RNs with 5 to 10 years of prior experience. And so to really walk you through each of our 4 aspects of our program, I'd like to introduce you to someone pretty special. And so without further ado, I'd like to introduce you to Nurse Nancy. And so Nurse Nancy is a seasoned healthcare professional. Specifically, she has 8+ years in behavioral health. Most importantly, Nurse Nancy is burnt out. Nurse Nancy's tired, and she's currently looking to relocate her current work assignment. And so Nurse Nancy is really the current landscape of our behavioral nurse landscape, with opportunities to improve work environments, both retention and our attainment rates of our experienced behavioral nurses. And so Nurse Nancy will really follow along with us in all 4 of our process and our programs here to really see if we can improve her experience as an experienced nurse. And so firstly, Nurse Nancy will join us along for our first aspect of our program, which again is focused on this recruitment aspect through our Community Ambassador program. And so really what we're thinking with our Community Ambassador program is how can we start really showing the impact and the environment that our hospital, South Coast Behavioral Health, offers to our experienced nurses. And so you can really think we're impacting first through the hiring process here of our nurses. And so Nurse Nancy fortunately has passed our screening process of the hospital, and she's been invited to really experience the culture at the hospital. And so there's a few different features with which Nurse Nancy will really get the experience to really experience, and she'll get an idea of the long-term impacts that she'll have as an aspect of our program. And so firstly, she'll get an idea with our local connection. So really what makes South Coast Behavioral Health what it is really the region that surrounds it, which is Dartmouth, Massachusetts. And so getting an idea of local connections that define the community, but then also getting that onboarding support through having that mentorship, buddy matching, but also having in-person interviews, and then tours and getting understanding of really South Coast Behavioral Hospital on a tour level and getting those aspects. And so thirdly here, we're also offering opportunities to get an idea of what life is like outside of the hospital. And so really with our work outings and our team building activities. And then lastly here, we want to provide opportunities to have an impact on the community in Dartmouth. And so with our volunteering outings. And so altogether we want to offer our prospect candidates what life is like, not only during that weekend of onboarding and hiring, but also what life will be like during their experience. And so our second piece here for recruitment is our relocation assistance package. And so in the case of Nurse Nancy, she's passed her screening process. And fortunately, we want to offer Nurse Nancy an offer, a full-time employment offer. And so what does that look like in terms of relocation? And so we're fortunate to provide a few different aspects here, two different pieces that we're offering that relocation assistance package. And so one is our financial assistance piece, which you'll see through some of our financial incentives for our experienced nurses. And then we're also offering support through a relations coordinator, really utilizing our existing human resource personnel to provide support for experienced nurses. So on the financial note, we're offering a competitive $5,100 financial incentive for relocation assistance. This is providing housing support and our apartment support for our experienced nurses and their family. And then at the end of their first year for their employment milestone, we're offering a competitive 2.5% bonus on top of existing bonus packages to encourage really those recruitment, but also that retention at that 1 year rate. So it's a bit on the finance piece. In terms of a relations coordinator, we're providing support for housing for our families in the region of Dartmouth. We're also offering support for our spousal job support as well. And then lastly here, we're offering our support through our school system search, again, to really assist with families of our nurses. And so it's a bit on really how we recruit and how we bring our nurses, our Nurse Nancy's and others in the system. How do we retain those nurses? And so we first want to retain our nurses through our really our professional advancement opportunities with training. And so really what we're focused here is providing opportunities to advance training and really growth within the hospital. And so the first aspect here is we want to offer a leadership exposure and mentorship program. And so we want to offer opportunities to get that exposure with C-suite executive, charge nurses, and other key leaders within the hospital. But we also want to offer that mentorship matching too. And so we're offering mentorship matching for our experienced nurses. And then lastly, we're offering a $2,500 tuition reimbursement as a piece of that really training and professional development. And then we're also offering our continued learning. And so opportunities to really get our training sessions. We really want to include internal opportunities. So again, some of the CBT trainings and there's opportunities within the hospital, but also external opportunities. And so options to opt into conferences and bring back that knowledge outside of Dartmouth and bring it really to South Coast. And then our last opportunity is through internal and continued networking opportunities to really understand and get an idea of leaders and folks within the system outside of specific departments for our nurses. And so that's a bit of our training, professional development, but we also recognize that our nurses themselves, that wellness is a key priority, but also family priorities is a key value for our experienced nurses. And so we're offering our last really piece of our program here focused on retainment, which is really our well-being and our family-centered comprehensive package. And so again, we offer two key pieces here focused on First, really the families of our nurses. And so we want to offer, firstly here with our childcare subsidies, so offering $1,250 for opportunities for childcare, and again, promoting that value for our families. And then we also want to offer our comprehensive health insurance in the form of $2,000 for our families. And so that's a bit on the childcare and our family side. And then again, focusing on the wellness of our employees, we want to offer 3 wellness days for each of our experienced nurses. We want to offer on-site mental health professional and counseling support. And then lastly, we want to offer a flexible work scheduling and a remote options, again, to allow time for nurses to really spend with their families and keep that as a key priority among our staff. And so that's a bit of our comprehensive benefits, our NurseWell package. And so I will hand it off here to Josue to do a deep dive on our financial analysis and really how we can fund what we believe is our pivotal program.
Okay, so let's dive into our numbers. So we have $8,000 monthly in budget. We're going to talk about this later, but we have like this time frame that we want to achieve our plan in 1 year. So that gets $96,000 in budget annually. So first we have the relocation assistance program. That is 45% of our total budget. And inside this we have the financial support for moving. That is like 60% of this program budget. So in the state of Massachusetts, we have a range in between $5,000 to $8,000 for this type of incentive. So our is going to be within this range. So we want to be competitive and we want to offer the best of the best to our nurses. Second, we have the Holistic Wellness Initiative, is 25% of our total budget. Inside this, we have the one part of the insurance dependent. That's 60% of our total budget of this program. Lastly, we have the route to leadership with the reimbursement intuition within this. Now we want to talk about the key financial metrics. So with additional 6 beds, we're going to have $3.2 million addition in revenue, $1 million in profit. So there's going to make us like 31% margin. We're going to be able to recoup our investment in less than 2 months with 10 times in the initial investment back. Now we want to talk about like one of the key important things here. So right now we have 60% turnover rate, which is no longer financially healthy. It's not sustainable. So we came with a plan to decrease this rate by 10% every year. So that is $900,000 savings in the first year, and in total it's going to be $2.5 million. Now to Sam to explain a little bit more about that.
Now, like Jose has said, we estimate that we are going to use a 12-month timeline to be able to implement this. Now, for us to be able to have feasible and accessible solutions by month 12, we've sort of lumped our timelines using a 2-month implementation interval. What this means on the overview is that within the first 4 months, we are going to engage in preparation and engagement. At this point, we're going to sort of liaise with unit level staffs. We're going to tailor the program to fit the solutions that we have just spoken about. The reason why we are doing this is to be able to have a synergistic approach so that we're able to avoid or overcome the initial resistance at the level of change management. Over the next 4 months, we're then going to go into recruitment and then rolling out the programs that Brad has spoken about, so our wellness program, our leadership development program, and having those community ambassadors being identified and being trained, and then fostering those sort of local connections where as these experienced nurses come into Dartmouth, we are pairing them with foots on ground and people who are able to take them into the system and see what the true attractions for them to actually remain in Dartmouth. Over the last 4 months, we are then going to sort of summarize this up by going through finalizing interviews, getting onboarding done, and then reviewing and having an access of our KPIs to just see how well the program has survived or how well it has done, and be able to sort of review that for the upcoming years. Now, we do recognize that there are obvious short-term winnings with this solution, and studies have also shown that nurses who are who are engaged at the community level have a 2-fold chance of retention. Now, what that means for our turnover is that we are going to be able to reduce our turnover from the current 60% to about 20%, which is fantastic, right? And then we are going to be able to also expand on our operation capacities to be able to have those 6 beds back online, bringing $3.2 million at the end of that year. Now, the immediate challenges here is the fact that South Coast is not able to keep nurses, and we're also losing money. And so this NurseWell program is going to be able to plug those two immediate concerns to sort of streamline and align with the overarching organizational goals, where we have nurses in the clinic and then we have patients on bed, bringing in revenue into the clinic. On the within the short-term impacts, we also see that when the nurses have improved mental health, they're able to do their jobs a lot better. So job satisfaction goes higher, and then that also has an impact on patient care, patient outcomes, as well as quality metrics, including the Press-Guinness scores. And recently, as we know that for Medicaid Part A, we are seeing reimbursements for Press-Guinness for hospitals for inpatient, and then Medicaid Part B, has reimbursement for outpatient services. So that's a great short-term impact. On the long term, there are three major concerns that we have. The first is an operational goal, that we're able to ramp up our capacity under 3% to excess of 5%, again bringing those beds back online and then increasing our bottom line revenue. The second instance, there's a workforce stabilization, where we're able to sort of block the back end and have nurses actually stay within South Coast. That way, we're able to boost staff morale, have the nurses not being overworked and overburnt. And then on the third prong of that is to improve our culture. That by that, we're also able to have improved in our organizational culture and reputation, where new nurses can actually get attracted to South Coast, and the existing cultures have been improved, and making an environment where the nurses can truly thrive. Now, we know that this comes with an associated risk, and I'm going to pass on to Kira to talk to us about the risks and our strategies for mitigation.
Thank you, Tosan. So lastly, we did consider risks and mitigation strategies associated with our proposal. So firstly, we acknowledge we're hiring from a very limited talent pool. And so for this reason, we recommend partnering with recruitment agencies to assist with that recruitment search, and also adding the relocation assistance benefits that Bradley talked about earlier. Secondly, we also talked about how there's a high cost associated with hiring nurses who are 5 to 10 years out of training. But we believe these costs are actually lower compared to hiring temporary staff. And there's actually additional savings on the turnover side, as we're able to decrease turnover costs and increase retention rates. Thirdly, we also thought about the fact that this is a short-term solution, but as Tosan so eloquently talked about, we are addressing the clinical staffing shortage in the short term, but in the long term, we're going to have these long-term benefits where nurses are investing not just in South Coast Behavioral, but also within the community through our Community Ambassador program. And finally, we did reflect on the impact this may have on current staff morale, given that not all of these benefits will apply to these nurses at this time. However, we believe that by demonstrating how hiring these nurses will, one, decrease the workload for the existing nursing staff, and two, overall allow for the expansion of this program, we'll be able to show them how they'll see a place for themselves, not only within this program, but within the South Coast Behavioral Hospital. And so, in conclusion, we believe that NurseWell is a comprehensive, research-backed, and fiscally responsible solution to addressing South Coast Behavioral Hospital's needs. And we believe that with our comprehensive benefits, with our relocation assistance benefits, professional development opportunities, and our Community Ambassador program, that we'll be able to help many nurses, including nurses like Nurse Nancy, find a place within the system and ultimately thrive. Thank you all so much for your time.
All right, I'd ask Team 14 to come down. And while they're getting ready, a little more context for the rest of you. They were all asked to solve the same problem, to try to make an impact on the South Coast Behavioral Hospital up in Dartmouth, Massachusetts, their retention issues with the nurses so that they could operate to their full capacity. All of these teams are required to have students from multiple professional schools. So you notice there was a mixture of students from Gillings School of Public Health up there. We had a medical doctor, MBAs. There will also be representation. I think in the total composition, we had representation from the dental school, nursing school, pharmacy school. So they're all required to have at least 2 schools represented on every team. A lot of these students never knew each other before joining these teams. So just to give you some more context as to how They are asked to come together in these ways and rise to the challenge. They're given 10 days between when the case prompt drops to get together, form, do the whole storming and forming and norming, all that process in 10 days that they have to do the research, come up with a solution, throw together a presentation, and then present. And then last week they also had to have a 10-minute question and answer period as well. So very daunting challenge. Just wanted to give you guys the context as to how amazing these people are. Oh, yes, sir.
Is this purely theoretical, or are you presenting this to South Coast?
So the South, that's a wonderful question. Actually, last weekend when they did the competition, they did have the executives from South Coast Behavioral Hospital down from Massachusetts to help in the judging of the teams.
Good afternoon, everybody. We are group number 14. I'm going to quickly introduce the team. My name is Martin Luque. I'm a first-year MBA student. We have Jorge Valleto, also first-year MBA student, Jamie Hunter, MPH student, Forrest Wilkie, an MD student. So, with our proposal, we want to empower the hospital nurses so that they can work in both inpatient and outpatient roles. And with this, we want to reduce the turnover rate. We also want to improve the work environment and also the patient's outcome. So Jamie is going to walk you through our rationale behind and also explain you the why.
Thank you so much, Martin. Now, I can predict what you're thinking. Why would we create a new department when we're already having a hard time with the department that we have? And the answer is this number. $4.26 million is how much South Coast is hemorrhaging every single year in turnover costs at their current 60% turnover rate. Now, that 60% is 300% higher than the national benchmark of 20% for healthcare facilities. And that's not even considering the impact on company culture, morale, expertise, patient outcomes. Now, if we continue to throw more headcount at this problem without addressing turnover, we're just going to be adding fuel to the fire. So let's talk about turnover. A 2023 Press Ganey survey of 123,000 nurses in the U.S. Highlighted a few different key factors with turnover. So a reduction or a lack of engagement, a lack of connection to the work, and a lack of growth and development opportunities were all associated with increased turnover risk. Something else that contributes to turnover, go ahead, is burnout. And we now know that over half of our U.S. nurses are experiencing symptoms of burnout. And even in specifically Massachusetts behavioral healthcare workers, they cited burnout as one of the top two retention issues. And our hospital-based RNs, like the ones at South Coast, are at an increased risk. They're 80% more likely to cite burnout as the reason that they've left a job in the last 12 months compared to their clinical counterparts. So burnout is multifactorial. There is no silver bullet. If you Google burnout reduction strategies or burnout reduction programs, chances are you're going to see something like mindfulness or increased access to mental health care. And now those are very, very important. But now you're putting the onus back on the nurses themselves to manage the symptoms of burnout. You're not actually addressing the root cause. Now, our team was not in the business of Band-Aids. And we really wanted to get at that key, that root cause, and eliminate turnover before it even starts. So what contributes to burnout? If you ask anyone, ask the internet, the top three reasons are staffing, staffing, and staffing, followed by compensation and leadership. Now, South Coast has done their homework. They've recently addressed their compensation. They've adjusted to market rates. They had a recent leadership change that has been well received. And they have, at least for now, a temporary staffing solution. So our team focused on these bottom three: growth, collaboration, and engagement. Okay. Now, in the public health space, we really love our causal loop diagrams and our systems maps. So I created one for this issue of turnover, burnout, patient outcomes, and the things that contribute, either mitigate or exacerbate these key items. So I have a little animation for you showing what happens when we apply increased investment and improve our job development and growth. Now you can see what's happening to these little bubbles, right? Understaffing, turnover, poor patient outcomes, burnout, they're eliminated. And what are we left with? An increase in RN expertise and efficiency. That's what we want. So how do we go about addressing this job development and growth? We wanted to find something that was going to be helping our nurses to really get back to what made them love nursing in the beginning. So I researched the full scope of the internet, and I found something very interesting on the nursing subreddit, which I highly recommend. So there was a paper that somebody posted about coming out of Spectrum Health in Grand Rapids, Michigan. They were having the same problem that South Coast was having, high turnover, high burnout. And they hypothesized that if nurses were given the opportunity to change up their clinical setting, perhaps even go to something that has a lower acuity, that they would see an increase in that engagement and an increase in their job satisfaction. So they did 2 cohorts, and what happened in those cohorts? Amazing things. Burnout, self-reported burnout was eliminated. Job satisfaction increased 100%. And their turnover in those cohorts, and even just as importantly, the intent to leave, decreased 78% in 1 year. That's incredible. And there was more benefits that they weren't really anticipating. Nurses got better at their jobs. They were able to provide more dynamic care. And there was an increased collaboration between different nurse departments. This kind of siloing was coming down. This us versus them was coming down. And it also helped them address surges during the COVID-19 pandemic in a really innovative way. And there's not that many hospitals in the US that could say the same thing. So, can we do something like that at South Coast? Well, South Coast is a behavioral health hospital. They don't have an L&D. They don't have an ER that a nurse could go kind of spend a third of their time. So that's why we thought, what about outpatient? This would also have the benefit of giving nurses an ability to follow these same patients from inpatient to outpatient and back out to health. Again, seeing people get better, and isn't that what nurses want to do? Like, from the beginning, isn't that what they've always wanted to do? And you see here, this is South Coast's vision statement with a very important addendum at the end. Being able to provide safe and compassionate care from beginning to end. So does anybody need outpatient clinic care? Yes, so much. They do. There are 14,000 people on the wait list right now for clinical outpatient care. And for our youngest people, our adolescents and our children, their wait time is 3 weeks longer than adults. This kind of a problem needs a bold strategy and an increased investment to help our most vulnerable rural communities. So that's our ask, is that South Coast Behavioral Health would create an outpatient clinic and implement this dual staffing model for their inpatient nurses to be able to practice outpatient as well. And we strongly believe that this will improve turnover, improve burnout, improve patient outcomes, upskill our nurses, increase collaboration, and improve their staffing and help them to be able to weather the surges that we are seeing so often in our clinical spaces. So I'm going to hand this over to Forrest to talk about the how.
Thank you, Jamie. So Jamie has talked about why we're doing what we're doing and what we're doing, but I'm going to talk about exactly how we're doing it. And I just wanted to start off by saying we had a really wonderful question by the gentleman in the back. He asked, is this hypothetical or is this based on reality? And everything that we planned, all of our logistics and planning is based on actual legal code in Massachusetts. This is in Massachusetts, right? Yes, I'm not a good presenter. Actual legal code in Massachusetts, actual financial costs of housing, licensure, all the regulations. So so we put a lot of thought into this. So what are we doing? So we are, so in the big picture, very high level, we are doing 2 things. One, we are implementing a training pipeline where we are going to train inpatient nurses to be upskilled. Not just trained to provide inpatient psychiatric care where they're faced with burnout, faced with challenging patients who don't really get better for weeks and weeks and weeks in violent settings. Spending a little bit less time in that because we're going to be training them to spend time also in the outpatient setting where they'll be able to see the same patients who have been discharged from the hospital in their outpatient clinics. They'll be able to see patients from their community in the outpatient setting who are well, giving them some respite from the challenging demands of the inpatient setting. So we're not only doing that, but we're also going to create a very collaborative environment where these nurses are not just trained, but also supported in a way that they weren't before. In result, yes. And like I mentioned, we dug into the legal scope of practice of RNs in Massachusetts, and also how their scope of practice is affected by particular certifications that we give them, or that we plan to train them in. And they are encouraged and given a pretty good level of autonomy to conduct patient assessments, to manage patients that have stable medication regimens and who are not acutely or severely symptomatic, in combination with like higher level providers like APRNs and MDs. So this all hinges on a certification that we found, which was called the PMHBC. So it's the Psychiatric Mental Health Nursing Certification. So it basically, this is a broad certification, but with the mental health if you achieve it in the mental health focus, it'll allow these inpatient nurses the ability to conduct psychiatric assessments, assess patient symptoms, manage or assess whether medication changes should need to be made, not actually making the medication changes. It allows nurses to provide psychoeducation and therapeutic counseling that is necessary in the outpatient setting and is sorely lacking in rural areas. And the requirements are stringent but not overwhelming. It requires at least 2,000 hours of psychiatric nursing experience and this certification exam. So that's the requirements. So that's logistically the first part. The second part is is kind of figuring out the boundaries of what our nurses cannot do. So our nurses are not just able to are not able to practice at the full scope of a nurse practitioner or a medical doctor. They are going to have very defined boundaries for what they can do, and we are going to define a very clear scope of practice and implement very specific protocols that allow them to know when to go ask for help when they've exceeded their scope of practice. We're going to have structured check-ins that make sure that our nurses are able to tackle even complex patients that are or structured check-ins with MDs and APRNs to make sure our even complex patients are getting the care they need. And we're going to implement a collaborative documentation process so that patients or medical mistakes in patients do not fall through the cracks. So briefly, what this might look like is if some of these criteria are met, such as medication-related concerns or a severe mental health crisis, our RNs would know immediately to notify one of the APRNs or MDs who are on staff, and they'd help and manage the patient until they're stable and can have a stable medication regimen. The timeline that we kind of ballparked for the training for this certification, the PMHBC, is we've devised a 4-quarter system where in the first quarter of the year, they'll spend 3 months training on to study for that licensing exam, which realistically given 3 months is kind of like a generous amount of time to study for it, given that we're going to take time away from their inpatient training and give it to them to study, and we've accounted for that in the budget. And then they're also going to be spending time training for outpatient, getting them ready for the outpatient setting. In the second quarter of the year, we'll slowly ramp up their patient load while they're still continuing their inpatient workload. And in the third quarter of the year, they'll be on a schedule of 2/3 full-time equivalent inpatient, 1/3 full-time equivalent outpatient, and so on and so forth. And nurses can jump into this and at any quarter of the year. Overwhelming Gantt chart that was actually originally like super duper long, but we simplified it just to say that we've accounted for a lot of the administrative processes, hiring, housing, not housing, we've accounted for that this is a phased process. We're not starting, when we say we're starting an outpatient clinic, it sounds like, boom, we're starting an entire outpatient division. What we're aiming for is a very slow stepwise process where we start off with a couple patients. We don't need to invest that much in much more than just an office space in the outpatient setting. And we build that up gradually over time. So this is a cyclical, repeatable process based on the actual logistical things that are need to be implemented. And I've talked a lot, but let's talk about the outcomes. Why is this worthwhile? So first we're going to talk about the outpatient outcomes, and then we'll talk about the inpatient outcomes. So even at a very conservative estimate of 2 nurses entering this pipeline per year, or per quarter, we project that in 2 years, by the end of the two-year mark, over 200 weekly outpatient visits will be being conducted between all our nurses per week. And this brings in revenue. Starting this outpatient business and the hiring is not free, and there is some financial burden. But even with a very conservative estimate for our income and being very generous with the expenses, we project that by the third quarter of the first fiscal year, that the project will have, just with the outpatient revenue, will have made its money back. And then why did we start this project in the first place? What was the onus for this? Well, we wanted to increase inpatient staffing. We project that realistically, by the 5-year mark, we will have increased inpatient headcount by 19 full-time equivalent of nursing labor. So basically, that's more nurses, more bed staffed, more patients that are able to get inpatient care. And how are we doing this? How are we able to increase nursing headcount? Well, based on very realistic numbers that were partially borrowed from that Spectrum Health experiment, we project that the decrease in turnover due to the decrease in burnout for the nurses that are in our cohort will follow this kind of trend, will allow for this kind of trend where the overall decrease in burnout drops from 60% to 37% in 5 years. With that decrease in turnover, we have a whole new revenue stream, if you want to put it like that, where we're saving over $1 million per year annually, based on the conservative estimate of a $40,000 turnover training cost per nurse per year. And I'll leave you with, is this realistic? Well, based on the 2-year numbers for the Spectrum Health experiment, where they took their nurses and had them staffed in different departments, their 2-year decrease in turnover was 3.7%. Ours is very much in line with that, 10.33%. Our numbers are a little bit bigger because this is a bigger project. We're investing more in our nurses. And our annualized savings are very realistic and in line with theirs. So is this realistic? Yes. So I'm going to turn it over to Jorge for financials.
Thank you, Forrest. So basically, to stress test our idea and see if it is financially feasible, we ran an operating a financial model. So our main assumptions are as follows. First, we created 2 different sets of scenarios, a conservative scenario, which basically is very conservative in the productivity of the nurses, and an aggressive or more optimistic scenario, which is basically that the productivity of the nurses increase, which helps our revenues a lot in the first year of operations. Basically, another difference between these scenarios is in the conservative scenario, we have operating costs that are basically at market, and in the optimistic scenario, we have in the conservative scenario, we have costs that are basically 50% above market, and in the aggressive scenario, we are not assuming costs below market, just at market level. So we try, in general, to be conservative with our assumptions. So we tested 3 different rates at which the nurses join our dual staffing program. In the first rate, nurses join at a rate of 2 nurses per quarter. In the second rate, they join at 4 nurses per quarter, and in the third rate, and the most accelerated version of our program, they join at 6 nurses per quarter. Basically, we see that under these 3 different rates, we have very good and positive results. Basically, after 5 years, we have, even in our most conservative rate, which is 2 nurses per quarter, we achieve yearly savings of turnover of up to $500,000. And the general turnover rate of the hospital decreased from 60% to 47%. And just to see if we are framing the budget risk correctly, in the next slide, we ask ourselves, so we are assuming basically in our overall scenario a 50-50% between the conservative and the aggressive scenario. So how much will this need to change in order for our budget to not being able to cover the first year operating losses that this project is going to generate? Because we know this project is going to be in a ramp-up period in which the nurses in the first quarter, basically, they are not going to generate revenues, but we are going to have costs since the beginning. So what we see here is that only when we assume that the weight in our overall scenario of the conservative assumptions is 90% of higher, we basically run short of budget to cover our operating losses until we reach break-even. So as we can see, the danger zone for our budget is generally small. So we believe that from a risk-reward perspective, this project is financially feasible. Now I will pass it on to Martin for our closing remarks.
So why do we think that this project is actually a great idea? Well, we can see that, as my partners mentioned, that first, this is a real model that actually achieves what we want, which is a reduced turnover. It's not a Band-Aid, it's a real solution. Then, with this reduction of turnover, what would happen is that the hospital will have a lot of cost savings, like $1 million per year. We just prove that this model have a high probability of being sustainable in the future, since actually before the year it gets the payback. Also, we have the budget to do it, right? We have also shown different scenarios in which we can achieve this project. Also, we have accounted for some risks and some ways of mitigating them. So what will happen if the demand won't be as expected? Well, for that, the hospital can actually do some marketing, and also we need to really invest in market research so that we can estimate correct demand in the future. Then what would happen with the quality of the services? If we go not only offer just the inpatient services, but we also offer the outpatient services, would they decrease? Well, actually, the hospital has also to take that into account, and we will provide like high quality standards and indicators so that won't happen. What about regulatory changes? The hospital right now has a staff of compliance team that actually they can assess those regulatory changes, so that wouldn't impact the actual model. And finally, what would happen if the nurses aren't really interested in the project? The hospital can also provide some incentives so that they would get really interested in the project. So thank you for your time.
All right, we're going to bring it on home for you guys. So we are Team 10, and this was our presentation for South Coast Behavioral Health. A little bit more about us. My name is Sarah Bayer. I'm a Doctor of Audiology student, and I'm here with my classmate, Casey Martin. I'd like to apologize for us in advance if we speak too loud into these microphones. We're really used to projecting our voices for these patients we work with hearing loss. So we are here today with our colleagues in the Keenan Flagler Institute, Nelson Westwood, and Parker Phippen, both in the class of 2026. So today we're going to talk about our plan to improve nurse retention at South Coast Behavioral Hospital by creating a culture of safety through education and organizational changes. So first we'll talk about our problem and then give our recommendation. Then we will go over the financial analysis and then our implementation timeline and procedure. So first let's talk about the problem. So this chart was actually given to us in our healthcare case packet, and it goes over nurse retention by specialty, or nurse turnover by specialty. So we took a look at not which specialties had the greatest turnover, but we looked at the ones that had the least. And that was pediatrics, women's health, and surgical services, just to name a few. We asked ourselves, what do these specialties have in common? And that's they each have a safe environment for their nurses to work in. So, safety is a necessity. This is something we've been learning since high school when we talk about Maslow's hierarchy of needs. Just to give you guys a brief refresher, if you don't remember, it's been a long time. First, we need our foundational pieces before we can achieve anything at the top of the pyramid. So, first, those are physiological needs such as food, water, warmth, and rest. And then we have safety, and these are our basic needs. Anything above that, we can't achieve without our basic needs. So not only can we not achieve success and self-accomplishment or achievement in our jobs, we're not going to stay in these unsafe environments. We're actually going to leave and find a new environment where we can feel safe. It's in our human nature.
All right, so that was a really, really great introduction about safety from Sarah. So that kind of brings us to our next point about workplace violence. So the National Institute for Occupational Health and Safety actually has a really, really great definition of this. So workplace violence is essentially going to be defined as any act or threat of violence or aggression. So whether that's verbal or physical assault to anyone who is either on duty or in the workplace. And this has actually become such a great issue among healthcare professionals, and in particular nurses, that the World Health Organization actually declared this a global public health crisis in 2022. So these are some statistics that I've actually pulled from across the literature, which really demonstrate this importance that much more. So what we've seen is that workplace violence and workplace incidences are actually highest among behavioral health nurses than any other occupation in the medical profession altogether. And they're actually so high that they're actually almost all of them combined together. So just to kind of walk you through these together. So the first one is 96% of behavioral health nurses have experienced some kind of assault, whether that is verbal or physical at the workplace. So these verbal threats are things like being cursed at, being called racial slurs, or even being threatened. 84% of these assaults actually took place in their very, very first year in the job force. So thinking about how that might impact retention or workplace standards and things like that. 60% have encountered a physical assault or physical abuse while they're in the workplace. So being punched, being choked, being slapped, being kicked, being spit on. So really, really jarring statistics here. And probably the most important statistic that I want all of you to take away from this screen is that 42% of these nurses don't feel confident that their administration and their management are going to do something to stop this violence. So why behavioral health? And why is behavioral health so impacted by workplace violence? I think that this question kind of has a two-part answer. The first would probably be the patient population. So behavioral health or psychological patients have a 5 times more likely rate to be aggressive than the general patient population. And then the second part of that is the actual work that these nurses are doing. So behavioral health nurses aren't nurses who are able to sit at their desks and work desk jobs. They are constantly going in and out of patient rooms, providing medications and different interventions. So that puts them at a really higher increased risk of this workplace violence. So there's something that has been kind of talked about pretty widely in the literature, which is called the cycle of workplace violence. So when we look at this, we see that there's a really high incidence of workplace violence among nurses, and particularly behavioral health nurses. The problem here is that these incidents oftentimes have really, really poor follow-up. So there's going to be a really inadequate lack of follow-up by administration and management, which causes a lot of really poor symptoms in these nurses. And some of them actually have PTSD or anxiety-like symptoms. So thinking about how that impacts how that does their job, we're seeing a high degree of burnout, we're seeing a high degree of job dissatisfaction, which is causing nurses to quit. And not only are they quitting their current positions, some of them are actually leaving the field of nursing altogether. And this affects how we care for our patients. So when nurses are leaving the field, we're seeing a higher ratio of patient to nurses and then also a decrease in that patient care. So kind of breaking that down just a little bit more. So workplace violence impacts nurses across a lot of different parameters. The first is job performance. As I mentioned before, behavioral health nurses aren't nurses who are able to sit at desks. They are constantly going in and out of rooms, and when they don't feel safe to do so, and they don't feel safe in their crisis prevention or intervention skills, they're not going to do their jobs to the best of their ability. The really second critical piece here is job recruitment. If you ask any nurse, and really specifically behavioral health nurses, what's one question you're going to ask in your job interview? That question is going to be, what is the incidence of workplace violence, and how are you training your staff members to handle this? If they don't like the answer to that question, they are not going to come and work at that hospital. So more recruitment is not the answer to this question. Job satisfaction and professional quality of life are two really big heavy hitters in this as well. Kind of as I touched on before, nurses who are experiencing a high level of violence in the workplace are going to be less satisfied with their job, and they might even display some PTSD-like symptoms.
All right, so let's talk about our recommendation to limit workplace violence at South Coast Behavioral Health. So we want to create a culture of safety at South Coast, and we want to do this in two different ways. First, through training and education by implementing crisis and intervention training, and secondly, through organization through the implementation of a safety leadership team. So I'm going to talk to you guys a little bit more about the training and education piece. We want all of the nurses at South Coast Behavioral Health to get crisis intervention and de-escalation training. We feel that this is really going to equip our nurses with the tools to handle aggression and mitigate violence, and hopefully stop these incidences from happening before they even happen. And this is going to improve our nurses' safety, but this is also going to improve our patient safety and hopefully limit physical interactions or physical interventions such as restraints, which can be really traumatic for these patients. So the current training that these nurses have, they don't feel like it's enough. About 37% do not feel confident in their crisis prevention skills. Half don't feel confident in their crisis